Welcome back to the show. I'm your host, Dr. Tracy Kim Townsend. Today, I have Dr. Kathryn Kloos, who is a naturopathic physician specializing in women's healthcare, pelvic floor therapy, and uterine massage. She is also a lifelong student, advocate, and pioneer in the field of psychedelics and facilitates groups and individuals with ceremonial plant medicine. She teaches professional level trainings and self-care retreats in the Pacific Northwest here. I first met Kathryn in Intertrek Psilocybin Facilitator Training Program. We were in the same small group together, and I always appreciated her extensive knowledge and experience with ayahuasca and how she brought that same level of reverence for working with the psilocybin mushroom medicine. In this episode, we dive into Kathryn's first experiences with mushrooms and ayahuasca, how a chance encounter in the jungle led her to pursue a degree in naturopathic medicine, the naturopathic approach to women's healthcare, and the role of uterine massage and pelvic floor therapy in addressing various health conditions. How psychedelic medicines can aid in the transition from maiden to matriarch, Indigenous practices with psychedelic medicines during pregnancy and breastfeeding, her most recent bout with stage 4 metastatic cancer, and the deep wisdom that poured forth from that experience. And we also discuss spontaneous cancer remissions and the biology of belief. This is an episode that you don't want to miss. I thoroughly enjoyed recording it with Kathryn. She has so much wisdom to share. And it really was an honor to host her. Without further ado, here is my conversation with Dr. Kathryn Kloos. Kathryn, welcome to the show.
Thank you.
So I'm so excited for the show. I feel like it was in the works for a little while. We had set the intention and it was just amazing. We crossed paths and we were in the same cohort in Intertrek, and I just felt instantly drawn to both you and your partner, your husband, and just the fact that just the way that you both lead your lives, which feel sort of radically different than how I grew up on the East Coast. And just opening my eyes to the possibilities of just a different way of working with specifically psychedelics and family structures and all of that. So we'll get into that because you're partnered with 2 children, and you met your partner through this work. But can you just share with those who are listening how you first kind of stepped onto the psychedelics, plant medicine, earth medicine path?
Oh, yeah. Oh, fun. Yeah. Well, the first time that I had a really powerful experience with mushrooms, an initiatory experience with mushrooms, was when I was 18 or something. And my friend and I had read the Celestine Prophecy, which is this like real spiritual book. And we decided we were going to drive and go camping in Sedona where the vortexes were, because we wanted to know about vortexes. And then we ate mushrooms and like in a vortex. And it was the first time where I felt the earth was alive. Like I felt the earth breathing. And it was the first time of like realizing, oh my goodness, it's not just the earth isn't inanimate. The earth is a breathing, living mother conscious entity that's so attuned and aware to me, and I'm connected to her. And so that was a huge experience. And then my first introduction a year later, I was 19 and I was in Hawaii, living in an organic farm, and I met these guys at the organic farm who were singing these beautiful songs, and I was like, oh, I want to learn those songs. And they're like, these are ayahuasca songs. And I was like, oh, I want to go to an ayahuasca ceremony. I don't know what it is, but it sounds great. And so my friend and I, we ended up driving. I had a Volkswagen bus. We ended up driving the Volkswagen bus from Santa Cruz all the way to Sedona. Again, it happened to be in Sedona. And we did 3 days of ayahuasca. It was a Santo Daime ceremony, which is a syncretic Syncretic means it's a folk religion. It's kind of a cross between where the Indigenous brought, the ayahuasca, and it intersected in with the people, the people living in the towns. And um, so it's a tradition from Brazil. And so I, drank ayahuasca with my friend in this ceremony at the same place where I had had this mushroom experience. And it was so incredibly life-changing. I mean, at 19, I remember closing my eyes and going into realms of what I now know are the bodhisattvas, like with the pictures of like these Buddhas and these realms. And that's where I went. And it was like, oh my goodness, there's no words. And so after that, my friend and I were like, okay, we're just college students, freshmen in college. And we're like, we don't want to drink in college anymore. We want to devote our lives to learning about the ayahuasca. And so we actually learned all the songs, and we went to Brazil, and we traveled to Peru with backpacks and a drum on my back. Yeah. And then so from the time I was 19, I was devoted to this tradition and learning about the tradition, learning about the songs. And I studied in Brazil, lived in Brazil throughout college and after college, and have really been on that path of the Santo Daime. I'm 46, so since I was 19. Yeah, and so I attended many, many ceremonies, and then eventually got permission to lead ceremonies, and that's where I met my husband. And so it's been a huge, huge part of my life. I would say that the ayahuasca has been like a very deep, intimate teacher, like a deep, intimate connection in my life, almost like a life partner.
Wow, that is incredible. I don't think I realized just how young you were when you stepped onto this path and getting exposed like that. What was the spiritual sort of background of your upbringing? I'm curious.
I was raised I was raised Christian, but I always wanted to I always felt a connection, but I remember being in church and being like, wait a second. I remember one of my first thoughts about Christianity in church was like, well, why is God a man? Like, could there be a woman? Like, well, how come there's no woman? And then like the whole thing about original sin, I was like, wait, I was born a sinner? Like, I don't know about that. Like, I really want to, like, I understand like the love and the charity, but there are some things that were really hard for me. Um, and also, with the plant medicines, I was able to have a direct experience of God, and not just like, oh, this is, um, I had a few direct experiences actually in the church, but, like, it's just with the plant medicine, it's just a very, very direct experience of the divine. So that was what has guided me.
Mhm. Instead of it being mediated through the priesthood.
Through somebody else's
Yeah,
interpretation. Yeah.
yeah. And also, that resonates with me where when I was going to church as a kid, which my family just did intermittently, when I was growing up,
Mhm.
how these stories that were always told from thousands of years ago, and it didn't seem to have, it was never made like sort of relevant to my day-to-day experience of reality.
Right.
And yeah, having that unmediated experience with um our own interpretation of the divine, of spirit, of source, whatever you want to call it, is
Yes. Yeah.
so um I believe it's how we used to practice religion way back
Yeah.
thousands of years ago. If you sort of go into this, which I've been fascinated learning about, even in the Western world prior to Christianity.
Mhm.
But so you were, let's see, 19, came across ayahuasca, found yourself devoting yourself to specifically the Santo Daime lineage within ayahuasca. Um, and
Yeah.
then take me, and then you met your husband in ceremony. as well.
Mm-hmm.
And then where along the path were you called to pursue medicine? You're a naturopathic physician. Sort of, can you take me
Mm-hmm.
along that part of the journey?
Yeah. Yeah. So when I went to the first, my undergrad was in herbal sciences. Um, it was the first ever graduate bachelor's program in where you could learn about herbs through Bastyr. And so I graduated from that program and I was like, okay, I think I'm just going to be an herbalist and a massage therapist. I had already done massage. And I went to Brazil and I spent a bunch of time in Brazil. And I was on this trip in a very, very remote region of the Amazon where I was with this activist guy and working with this medicine woman who made all of these anti-malarial herbal remedies. And so we were on this little boat going down into these tiny little tributaries and delivering these herbal remedies. And I ended up staying in this very, very small town in remote Brazil. And me and this guy kind of hit it off. And he was like, I want you to just stay here and live. And there was a medicine man there who ran ceremonies there, and his daughter, her name was Ita. She was there and she knew all about the plants. She was an incredible medicine person. She was so developed in her connection with the healing world as a teenager. And I said, if there's anything that you could do, what would you do? And she said, I would be a doctor. And I was kind of playing with the idea of going to naturopathic school. Um, but when I heard her say that she wanted to be a doctor, and I knew she would never be able to be a doctor because she didn't have the funds. It's like super rural, very, very poor, low income, I was like, wow, I have to use my privilege and become a doctor. And so I applied to naturopathic school so that I could bring the medicine back down to these people and collaborate. So I decided to become a naturopathic doctor. I went to school for 5 years. And in that, I really took to women's health. And so that's where I resonated with the uterine massage, the pelvic floor work, and women's health just called to me. And so my medicine life and my doctor life have been completely separate. Like even my colleagues don't know that I'm a medicine person. It's been very kind of secret. That's not to die me is legal, but it's just not something that I shared with people. But now the psychedelics are more talked about, and psilocybin's legal, and ayahuasca's more normalized. Now I can be on this podcast and just talk about it. But for many, many years, I didn't talk about it, even though I did. For my patients and colleagues and friends and everybody, I think could benefit. A lot of people.
Yeah. So, okay. So you're finding yourself in the merging of these worlds, kind of the spiritual healing versus the sort of more physical healing. But as we know, that's an arbitrary distinction that when there is sort of dis-ease spiritually, it often manifests physically and vice versa. When we're not feeling physically well, it can dampen our spirit. So for those who aren't as familiar with naturopathic physicians or the naturopathic approach to sort of health conditions, can you share how it differs from conventional medicine, from
Yeah.
how
So
sort of Western allopathic medicine approaches things?
Yeah. So naturopathic medicine has its roots in nature cure. And so one of the main tenets is really looking at the whole person. And so in allopathic medicine, there's, specialties and looking at parts of a person, and you go to this specialist and this specialist. And the naturopath really looks at all aspects of your health, including your family life and your sleep and your exercise. And so it's really, really holistic. And then we utilize herbal medicine and homeopathy, nutrition, exercise, and mindfulness techniques. And naturopathic medicine is a really broad profession. But really, one of the central tenets is really trusting in the life force of the person. And so whatever we can do to enhance the person's own innate healing capacity and help to remove blockages. So help to, like, for example, detox the liver, or help to create the body to efficiently digest. And so we look a lot at like food allergies and sensitivities and things that might be creating inflammation in the body. And then, yeah, working with nutrition and herbs and um, the different functional lab testing, we can help guide the person with their hormones and their inflammation levels and their gut health. And yeah.
Yeah, so it sounds like too that it is I I just remember Dr. Erica Zelfand, who's one of the lead instructors
Mhm.
within InnerTrek and also comes from a naturopathic background. Um she showed this image where of like a naturopathic physician's approach to levels of intervention,
Mm.
and starting out by first removing what can be inhibiting
Yes.
the body's natural healing response, which
Yes.
when we talk about the innate healing capacity of the body, everyone has experienced that. If you fall and scrape your knee, or you
Right.
accidentally cut yourself, right? That the body will, as long as you keep it clean and you don't do anything to interfere, the body will naturally heal that wound.
Yeah.
And we actually see later on in life when people have sort of end stages of vascular disease or diabetes or something like that, that the wound healing body's natural wound healing capacity is diminished,
Mhm.
and that in those cases, just a simple cut can actually be potentially life threatening. Um, and so when I saw that approach of like, let's first remove what could be interfering with the healing process, that resonated so deeply with me, and it's so not the approach taught in sort of Western allopathic medicine. But we all know that an ounce of prevention is worth a pound of cure. So
So true.
taking that approach really resonates with me. And then, of course, working with plants too. How does this play a role um, in the way that you approach specifically women's health and the specialization that you've taken in pelvic floor therapy?
Mhm.
I'd love for you to share more about that.
Yeah. Yeah. So with women's health, pelvic floor therapy, and uterine massage, I really take the naturopathic approach. So, like, for example, for um and with uterine massage, I was trained by Rosita Arvigo, who was trained by some healers in the Maya lineage. And so that's the lineage that I am coming from in terms of my training with the uterine massage. And then I've kind of adapted it and created, because I've seen thousands and thousands of patients. This has been my specialty, so I've kind of adapted the techniques and made my own techniques. But the idea is that if the uterus is out of position, and this is something in gynecology nobody talks about. Oh, you have a tilted uterus, like, big deal. But it actually is a big deal. So if it's too far back, like if it's retroflexed, it's going to push up against the sacrum, and it can create congestion there. So if we're talking about obstacles to cure, like you're talking about, that can actually create some like constipation or some pain, sacral pain with menses. So people who have their menstrual cycles, who have really painful low back pain, sacral pain, it's probably because the uterus is tilted back and it's pressing on those sacral nerves, and the nerves are then radiating and causing pain. And so there's all different positions the uterus can be in, but if the uterus is aligned, then it creates a healthy flow. And so, like with naturopathic medicine, we're really looking to create the best flow in the body. And so, like, if it's tilted to the right or to the left, it could be compressing an ovary. If it's compressing an ovary, you're not getting the proper vasculature flow and lymphatic flow and the influx of hormones and the right chemical hormonal messages from the brain to the ovaries. So the massage really helps to get the uterus in alignment, and that can help with irregular cycles, fibroids, all sorts of digestive issues. So yeah, all sorts of like endometriosis can really be benefited. And then with the pelvic floor therapy, um, I really feel like as women, nobody really talks about it, but we hold so much, so many of us hold so much tension in the pelvic floor. And the pelvic floor is like a portal. It's the birth portal. The vaginal area is the birth portal, but it's also a portal that over the millennium has had a lot of pain, a lot of abuse, a lot of repression. And so to be able to work with women with their muscles that might be tight or there might be pain, is also working on those other collective levels if the person wants to go there, because those collective levels can be there, like body shame and also ancestral pieces of like how we through epigenetics carry the stories of our mothers and the traumas of our mothers, grandmothers, and great grandmothers, and it all goes somewhere. So where is it going to go? So the uterus, the pelvic floor can be a place where a lot of women hold this. And so working with the pelvic floor therapy, yes, I work to treat, incontinence, stress incontinence, or pain, prolapse, which is so important to treat. But also we can help to a woman to feel, or a person with a vagina to feel more supported in their life, to reclaim that area, to occupy that area. Like so many people aren't even living in their root because we're such a heady culture. People are disconnected, and maybe their first time experiencing their root is when they're giving birth, and they're like, "Oh my goodness, this is traumatic." Like I haven't even gone there, since maybe this trauma happened, and then it opens up a whole can of worms. And so it's a real honor to work with women in these areas and with these themes. I feel like actually it's it's an awakening that's happening. It's an awakening to say, oh wait, we can have joy in our roots. We can have creativity. We can own it. We can make it bigger. We can occupy space. This is our bodies, and we can start to teach that to our daughters and to our sons, and to kind of balance things out in it between the masculine and the feminine, everything in between.
Mm-hmm. This womb awakening that seems to
We're
be
all
for
working.
sure happening. I see it a lot in my generation with a lot of millennial women saying no to hormonal birth control,
Mm-hmm.
and reclaiming their cycles again. And that was a huge journey for me when I was put on birth control when I was only 17 years old, because I was
Mm-hmm.
seeking out help actually for my skin. I had
And
it runs in my family, just like acne. And
mhm.
my younger brother had it too. My mother had it. Her father had it. And it's been amazing to go on this journey. I saw a family medicine physician, and he was like, "Oh, your 17-year-old girl's skin problems, birth control pill," and
Right.
no informed consent.
Right.
It cleared my
It
skin, but
helped. Yeah.
it helped, but it didn't. I hadn't had regular cycles by that point. And so I never got to develop like this relationship with my cycles and my body, and to have faith in that.
Yeah.
And that was all just shut down. And it never allowed me to get to the root of why I was having skin problems, which is, I now know today, totally correlated with my diet,
Yeah.
and just my overall kind of like stress levels in my body.
Mm-hmm.
And so, I was eating all sorts of processed stuff at the time, and things have totally shifted since then. And it did me a disservice as well, because when it came time to, when I wanted to have children, I, was mistaken in thinking like, "Oh, I can just stop the pill and then I'll start ovulating again right away." And I was so deep in my masculine at the time too, thinking I could time and exactly plan such a thing.
Right.
And I found myself at 30 years old, feeling like I was going through puberty again. Like I had never
Okay.
completed my pubertal development, just on a hormonal
That makes
level.
sense. Yeah.
And so, anywho, I did want to ask, how your journey, you started with, these psychedelic medicines
Mhm.
from a young age,
Mhm.
and then you went on to, marry and become a mother of
Mhm.
two children. What has it been like to move through that maiden to matriarch
Yeah.
transition, which is a huge archetypal transition within
Mhm.
the feminine, with psychedelics? What role did they play for you?
Well, so in the Santo Daime, there's a whole there are communities in Brazil where where women during pregnancy, not the first trimester, are given a ceremonial dose, like a small dose of the medicine. It's actually safe in the second and third trimester. And it's not the kind of dosage that you think about, like if you go to a Shipibo ceremony where you're vomiting and having these huge experiences. It's a very light dose to just kind of tune in. Um, and so, and then in the communities, you see women using daime for daime is the ayahuasca, but using the ayahuasca for everything. If you're like a little bit sick and you have a cold, you take a little bit of the ayahuasca mixed with propolis and honey. Um, it's pretty much used as a medicine, and so it's also used in birth, and it's also used in death, the death portal. And so because the Santo Daime is legal here in the United States, I did, small doses throughout pregnancy. And it was so helpful for me to tune in to my baby and to tune in with the process of like maturation. And for me, what the ayahuasca is, it's not just like some sort of substance that I'm using to get high. It's like having a guide or a teacher. And so when I take the substance, I meet my teacher, and it's like helps open the door to my own intuition, to my higher self. And so to be able to, and also to my higher self, and also to energies that are larger, cosmic energies that are larger than myself, to the forces of nature, the sun, the moon, the stars, the earth, um, to access my intuition, to access ancestors, to really open up the sense of connectivity that I feel like we've lost in our Western culture. We're so mental and materialistic. So when I take the ayahuasca, it helps me to really connect to those elements. And so when I took it, in my pregnancy, it really helped me to connect in with myself at the time and the spirit of my child, and help guide me. It's a total teacher. Like it gives me advice. Like, hey, you're not doing those things we talked about last time. And so you need to kind of check yourself and change those habits. Those habits aren't really serving you. So it works like that. And then I did a little bit during birth. So with my first son, he had a very large head. His head was in the 100th percentile. And when I got an ultrasound, the OB was like, "Oh my gosh, you've got to get this baby out soon. Like he has a big head." And I was gonna have a home birth. I did have a home birth, and it was a really, really, really long labor. And, I was like, "Oh, I don't know if I should take the medicine," but at a certain point, I was like, "You know what? I'm gonna take some." And as soon as I took some, it showed me that I was too afraid of the pain. And so what I was doing was all of my energy was up in my head and my shoulders and my jaw because I was trying to avoid and resist the pain. And what it did is it said, no, no, go into the pain. And it really just helped me to trust my body and trust what was happening and like face the pain and go right into where it hurt the most and connected me in with my legs and my feet and I was able to do it. Like I had a very good midwife. I think a lot of other midwives probably would have transported me to the hospital, but she trusted in the process and she gave me some space to work it out, and I'm really glad that she did. I was able to get him out. And then um and then as a mother raising children, what I notice is, if I give myself time to do the ceremonies, it's like the ultimate form of self-care. And so if something is like I have a tension in my body or a stress or whatever I'm carrying from my life, we all have the things that we carry around that are hard for us. And the medicine helps me to see it and clear it and connect to my heart. It's so interesting that, like, when I come home, I notice my kids will be so much more calm. And my kids totally respond to the change in my field because of the work that I've done. Like they totally feel it and vibe off of it. And so it makes me realize, oh my gosh, when I'm in this different vibration of like more of an embodied, heart-centered, grounded place, because I would say that's where the medicine takes me, my children can feel it and they feel that I'm like not in my stressed body as much. And so
Mm.
that's been really helpful. But I would say one thing too that was really missing that I noticed, and I think that this really caught me off guard. And this wasn't addressed in the ceremonies that I've done or in the tradition that I'm from that I missed was I really needed, I mean, I had a blessing way ceremony, which is like, well, kind of like an alternative baby shower, just like more of a spiritual baby shower kind of thing. But what I needed was a ceremony to like almost like a death ceremony of the maiden. Like I thought that I could just be the same person that I had been with all of the liberties and freedom that I had when I was a maiden. And when I came into motherhood, it was quite the shock. And so I actually, if I could redo that, I would have some sort of like actually like putting the maiden to rest and really accepting that motherhood comes with self-sacrifice and responsibility. And it's not easy, but that's part of like what matures you and helps you become like wiser and a deeper caring human being and not so self-absorbed. But that was a big shock for me. Yeah. He gets a shock for all of us. And I feel like there needs to be like a ceremony around it. Like I feel like nobody talks about it and it catches everybody off guard. And that's why there's like postpartum depression and so many moms feel so like isolated and sad and like lacking community. And it's a really hard time for moms right now. Like with so many expectations to work and produce and be a good mom and like it's with like limited family and community support and everything's on the nuclear family. It's really dysfunctional. It's a really dysfunctional time for families, I think.
Mhm, mhm. Yes, you're speaking to, um, yes, an incredibly prevalent societal ill that we are moving through, and mothers are kind of expected to fend for themselves in a time when we are so profoundly vulnerable and like by necessity, all of our needs get put behind the needs of this newborn infant that is
Right.
completely dependent on you 24/7. And so with the mother taking care of the baby, we need the who is going to take care of the mother. And then you have fathers who are um, expected to provide for the family financially and materially during that process. And so, he can't always be there to help take care of the mother. And so some people are patchworking together, with a doula, or maybe you
Right.
are, yeah, maybe you are blessed to have a family member, a close friend, or something like that at that time of your life during your childbearing years. But it is so difficult now, and the amount of women that are now put on some sort of psychiatric medication during this period of time, which is like both preconception, and then during pregnancy, and then after, while breastfeeding. This is also becoming an intergenerational thing that we're going to have
Definitely.
to sort of contend with. I do wonder about what the role these medicines can do for mothers while we are still in this process of hopefully reshaping society to be more supportive of birthing children into the world. I mean, I think it's pretty well known by now that fertility rates across the world are plummeting.
So,
The birth rates have fallen actually well below replacement in most modernized, industrialized cultures. Um, and if you talk to people who are of childbearing age, I mean, they'll tell you it's a pretty hostile
it
world
is.
for new parents. Not to mention that we aren't psychologically prepared for it. We're such an individualistic society, and sort of these modern westernized societies, and the transition can be such a shock that I think it can scare potential parents off. um, so so what would you sort of recommend that young women do if they decide, hey, I actually don't want to go, like, I want to have children. I know it's going to be challenging, but this is, I'm called to be a mother. I don't want to, go down the path of pharmaceutical psychiatric medication. What does it look like to opt instead for working with a plant medicine ally, whether that be psilocybin mushrooms or
Mhm.
ayahuasca?
Mhm. I think that it could be really, really helpful. There's been studies, I mean, I can't cite the exact study, but there have been studies that show that the psilocybin definitely increases serotonin. So for, mood issues, it can really, really help with the serotonin levels. And then it can also, I mean, I feel like if somebody feels drawn to work with the plant medicines, and work one-on-one or work in a small group, it can really also help to open and resolve, um, birth traumas, or what didn't get resolved during the birth. Because oftentimes, a new mother is just thrown into mothering, and they just have, like, the biggest experience of their life of giving birth. And I feel like the psychedelics really match that vibe of giving birth. And so it can help to integrate that experience. And then, but what I would say that's really, really important is that the mom needs to take some time after, like the next day. So to not just jump back into parenting 100%, like maybe see if you can get a babysitter to come in and maybe be a halftime parent, or, but to really allow that integration is going to be helpful. And I know that there's lots of microdosing protocols for women in their cycle and the luteal phase for, like, you know, uh, PMDD, or, having the low mood, depressed mood, irritable, mad, anxious during the second half of the menstrual cycle, but also, um, you know, in the postpartum times too.
Mm-hmm, mm-hmm. I get questions all the time about, is psilocybin safe during postpartum during specifically when a mother is breastfeeding? How would you answer that question?
Yeah. So I there have been studies that show that the psilocybin is in the breast milk, and then after 12 hours it's cleared from the breast milk. So what you can do is, if somebody's breastfeeding and they're gonna have they can pump before they do the psilocybin, and just have the baby drink from a bottle, if the baby will take a bottle for that time until that time wears off. So that would be a way to have the child avoid the psilocybin. um, and in other cultures and other countries, they don't see the psilocybin or the ayahuasca as a drug. They see it or something that's harmful. And so, I've worked with the Mazatecs and Maztecular Eugenia Casimiro. Asked her, she's from the mushroom tradition in Oaxaca, and in Huautla, where Maria Sabina was from. And I asked her the same question, and she's like, "Yeah, women breastfeed after having taken mushrooms. We're not afraid of it. We trust it. We know that it helps. It helps the baby. It helps the mother, and it's coming through in such a small dose. But I would say, just for the legality issues and where we're at, we can look to the other cultures, and then we can also just see, you know, what the studies say here in the U.S. if we want to be careful in that way.
I approach it from a biochemistry kind of perspective. That's what I studied in undergrad, and then and when I look at and I also just look at sort of other substances that we've okayed for pregnant and
Mhm.
breastfeeding women. And so take alcohol, for example, as a substance.
Right.
We've culturally, and scientifically studied it, and we've okayed small amounts, especially, third trimester. And then certainly, postpartum is okay. It's not going to harm the baby, even though we know alcohol gets passed on through the breast milk. And even
Mhm.
though we know that alcohol is a known neurotoxin
Right.
and hepatotoxin is
Right.
known,
Right.
but in small enough, dose makes the
Right.
poison. And so as long as the dose is low, you're safe, you're fine.
Yeah.
And then on the extremes of it, we do see fetal alcohol syndrome and stuff like
Right.
that, right?
Right.
But then when we take the psilocybin mushroom, it is not only is it not a neurotoxin or known to be toxic to any organ systems in the body, but is actually potentially a neuroregeneration, aids in neuroregenerative. And so
Yeah.
that's what I like to kind of just look at in terms of just checking our biases and conditioning around all of this stuff, and,
Well,
and point those things out. And especially when it comes to the mental and emotional health of the mother, like you said, like the baby is completely attuned to the nervous system of the mother. And so
yeah.
if we can nourish and support the nervous system of the mother, that is
Right.
going to help in her bonding with the baby and help with the social emotional development of that child in the critical years, just like those initial, when the nervous system is being laid down, and wired, if you will. So I'm, if you can't tell, I'm pretty pro supporting mothers who feel called to this kind of support.
Right.
And especially with thank goodness we have these indigenous wisdom carriers
Mhm.
to show us that, like, look, it's okay. Um,
Oh, okay.
yeah, and
Cool. Interesting. Right.
not only is it okay, but these medicines have been with us since the dawn of time. And so we've
Right.
actually co-evolved
Right.
our nervous system and consciousness with these medicines. And it's
Right.
actually, in evolutionarily speaking, a weird time that we've entered into in the last couple thousands of years, where we haven't been collectively sitting with these medicines. And perhaps that's why we're seeing all of the problems that we are experiencing now. And so I do see mothers as playing a very especially like a very pivotal role in this. First, the reclamation of the birthing process. Just, I mean, even just choosing a home birth and choosing to go through that portal completely, unmedicated, and just being with that whole experience and what that unlocks at all different levels, for both you and the infant, and not interfering with that process. What gets unlocked there. Um, but you touched on this piece too, really, that speaks to the self-care that mothers really ought to let go of any guilt around taking for themselves. And so, because I have spoken with several potential clients for psilocybin facilitation, women who are who are mothers, working mothers like you and I, who are, maybe not in that immediate postpartum, but, children are a little bit older, a little more independent, or maybe entering school age, and you kind of finally get through that, to a new position in the portal, really. I don't know if the parental portal ever really ends, but you at least find yourself like being able to breathe. You're not just treading water every day. And maybe you're starting to recognize where, I'm not able to bring full presence with my children. I am just, feel like I'm spread so thin. I'm feeling called to work with plant medicine, so I'm new to it, but I feel so selfish and guilty, and like, how can I invest the time and the energy and the money and the, asking for the support that I'm going to need for it? Like, well, how would you counsel a mother who is wrestling with all of that?
Well, that's a really good question. I mean, I would just say, look at what you are sacrificing and what you are giving out, and look at what's coming in. And if this working with this medicine has the potential to give you the breakthrough that you need in order to occupy your power more and your agency more and access your intuition and feel more grounded in your body and help you clear some of these traumas that you haven't been able to clear, and it's going to help you guide you to like your deepest sense of homecoming in yourself, then that's priceless. And that's going to educate your kid. Like, that's the best education that you could give to your home and to your family and to your kids. And you're totally worth it. You are totally worth the time and the money. If this is going to help you to be less anxious, if this is going to help you sleep better at night, if this is going to connect you to the creativity that you haven't been able to access because you've been working and you've been parenting, and to create the space for you to go into like beautiful places inside of yourself and awaken different parts of yourself that were latent that you didn't even know, and deeply commune with yourself. That is absolutely priceless. If you feel drawn, then there's a call, and you've got to follow the call. And sometimes it takes a sacrifice. And you've got to and it's okay to ask for the help that you need to make this choice for yourself.
Mm. Wow, if that's not a call, then I don't know what is. That is the working with the worthiness piece, and the worthiness to fully receive, and which will help you to actually give more from a place actually of a full cup of love, rather than resentment, which can often set in when we are imbalanced in that giving and receiving of our energies. Um, I also wanted to ask you a bit, taking a little bit of a turn towards a more recent healing journey that you've been on. So, do you mind just like taking us through kind of the beginnings of that journey, the first sort of inklings of it, and then the portal that you've passed through recently with your own, healing?
I want to. Yeah. Wow. 2024 was a doozy for me. It was a huge doozy. So basically, I was completely unexpectedly diagnosed with a very large tumor, cancerous tumor in my colon. And I absolutely didn't see it coming. And sometimes I ask, like, that's so strange. I do all of this medicine work and I'm really intuitive, and it was completely off my radar. But I think that it was part of the wisdom of it all. I trust in how the whole thing opened, that I was supposed to be in this kind of shock. So I'll back up a little bit. But basically, and I'll give a plug for getting your screening exam. That's one thing that naturopaths do too. We do PAPs. We refer out for colonoscopies, DEXA scans, mammograms. We are have our feet in the allopathic world too. And I'll say here, the rates of cancer are completely skyrocketing. They are skyrocketing. Younger and younger women are getting diagnosed with breast cancer. Colon cancer was completely off my radar because I have no family history. I eat super healthy. I exercise. I try to live a really clean life. So it was 100% not on my radar. And what ended up happening is I started to get like, some abdominal pain. I thought, well, that's weird. And it just so happened that I had like 5 days of acute abdominal pain. And it was at the time that one of my sons had like a stomach bug. And I was like, oh, well, I got a stomach bug. That sucked. And it completely went away. And then 1 month later, almost to the date of 30 days, I got it again. But my other son was sick with a stomach thing. And I honestly think they were just picking up on like in retrospect, I don't know if they had a stomach bug or if they were just feeling me in this process. But so my other son had a stomach ache, and I was like, wow, I guess I'm prone to getting every stomach bug that comes around. And then it started to come like more intense. And it was like, it felt like really intense gas, but I had no changes in my bowels at all. It just felt like really painful gas. And I thought, I went to India last year. I bet I have a parasite. So I did some stool testing that tests for parasites. It also does like the occult blood, which checks for colon cancer. And the test got lost, and they didn't have it. Like, I waited 3 weeks for the results, which would have told me that I needed to get a colonoscopy right away. They lost my test. So I had to redo the test. And in the meantime, I was like, you know what? I'm just going to treat myself for parasites. Something's going on and I don't have answers of what it is. And so the pain started to get so acute that I was like, wouldn't be able to show up for work. So I was missing days of work. And then I had one moment where the pain was so intense. I was like, you know what? I'm going to the hospital. And I went to the hospital and I thought, I know what this is. I have a duodenal ulcer and a hemorrhoid because I was also that day I was having a lot of blood in the toilet. That's what took me to the hospital. And I was like, I have a hemorrhoid and a duodenal ulcer. And so when I went into the hospital, the ER doc was like, yep, I think you have a duodenal ulcer and a hemorrhoid. And I'm going to send you home with some Prilosec. And I talked to my friend who's an ER doc, and he's like, really asks, tell them you want a colonoscopy and an endoscopy. Like, you really need to advocate for yourself. You need to get imaging while you can get in and you're here, because he's been seeing me going through so much pain. And I was like, I really want a colonoscopy, endoscopy. And they had a shift change and I got a new doctor. And this doctor was like, okay, I'm not going to send you home with Prilosec. I noticed that your hematocrit, you're bleeding somewhere. So we're going to keep you overnight. So they kept me overnight. I did that fleet enema at like 2 o'clock in the morning, and like walking around my hospital room, trying to get down a gallon of this like polyethylene glycol. But I hadn't been eating for 2 days because I was in so much pain. And I went in for the colonoscopy. When I got out, the doctor came into my room and he's like, you have a very large tumor obstructing your transverse colon. It's malignant, and we need to check to see if it's spread through your body. And I was just like a deer in headlights. I was like, my mom was in the room and I was like, what are you like? It was not on my radar. I mean, it was, but it was low on the list of possibilities. I had talked to my naturopath about it, and we're like, no, you're too young and healthy for colon cancer. This is probably a parasite. And so I was just shocked. And then, they took me in to get to get some more imaging, to get a CAT scan. And then they brought the news. They said, this has spread to your liver. You have stage 4 cancer. So I got all of that information like while I was in the hospital, and I hadn't eaten for 3 or 4 days. And they were like, we're going to keep you here for abdominal surgery. So we're going to have you not drink. So now I had not eaten for 3 days. Now I was going to not drink for a whole two. They couldn't get me in for 2 days. So no drinking, stage 4 cancer diagnosis. It was like the ultimate. It was like the ultimate. Like, okay, how am I going to handle this? Like, what am I going to do with myself here? And so I didn't sleep hardly a wink for those 4 days. And I was just basically in every spare moment I had to myself, I was like, I am not going down this trajectory of stage 4 cancer. I'm just not going to do it. And I am going to call in all of my guides. I am going to use the power of prayer. I'm going to use the power of visualization. I use visualization with my patients a lot. And I am going to imagine this tumor, the tumor cell, the tumor shrinking. I'm going to imagine the cells turning into light. I'm going to release the malignant cells. I asked everybody I know in my extended community to hold a visual for this surgery I was going to get. And basically, I I spiraled. I went to there were a few times where I completely became like spiraled thinking about like losing my children. That was a huge one. Like, oh my gosh. That's like one thing I cannot do. I'm not going to go there. And so like just thinking about that really, like I had to call my friend in Finland because it was 3 o'clock in the morning. And well, it was when I was like, oh shoot, is my insurance active? And I went onto the website at 3 o'clock in the morning and it said, we can't find your file. And I was like, oh my God, my insurance isn't active. We're gonna go into complete bankruptcy because of this. This is gonna be so expensive. And I'm gonna lose my kids. It was so intense. And so I called my friend who's an acupuncturist at 3 a.m. my time, which was daytime her time. And I was like, Sandy, will you please lead me through a guided meditation? Like, help me to like center myself. And this is kind of like when people are spiraling in a mushroom, journey of like complete trauma spiral, not in the body at all. And she really helped me to ground myself and resource myself. And I was able to like find my center. And what really, really helped me, one of the things that really, really helped me is the Tonglen practice. And that is a Tibetan Buddhist practice where the way that I handled the thought of losing my children was I connected in with all of the women, all over the world who have lost families, who are in war, who are losing their children left and right, who are having to die, who are on their deathbed. And I just connected in with all of them suffering the same kind of suffering that I'm experiencing right now. And just breathe in. The practice is to breathe and connect with everybody else who's experiencing the same thing. Breathe in that suffering into your heart and breathing out love and compassion, and breathing in the suffering into your heart and breathing out love and compassion for all of the beings who are experiencing this. And this really helped to me to realize a few things. One is that because we live, like you said, in such an individualistic culture, we think that our suffering is uniquely our own, and our problems, our anxiety, our depression, our digestive problems, our endometriosis, whatever, our relationship problems, that there's something wrong with us, whatever. But the truth is that it's collective. We're all in this. There's an elder who says we're all in this leaky canoe together. We're all experiencing something. So it's actually like to take comfort that you're not alone in your anxiety, in your depression, in your isolation. Like there's so many others experiencing. So I can mentally reach out to who's experiencing this and tune into the pain and help to breathe out and send out compassion to all beings who are experiencing that. It takes the charge off of the individual, like me, my loss, my pain, my body, into like, wow, this is a we situation. And then it also like really showed me, wow, this tumor that I have is exactly like what's happening with the earth. The earth is dying right now. The earth is sick right now. And the earth is polluted right now. The earth is cancerous right now. And like, okay, so if I can use prayer and I can use my mind to shrink this tumor, which I did, and I'll tell you that, to shrink the tumor, then we can all collectively imagine a different prognosis for the earth. Like we can all say prayers for the earth. We can all change our own unique vibrations and shift things for the collective. And so that's became something that I really feel like working with groups and working like if we can all shift our frequencies, we're shifting the frequency of the planet. And people heal from, they call it in Western medicine, spontaneous remission. But there's been a lot, and then these are like people who what the oncologists are like, well, you don't have stage 4 cancer anymore. And now you're fine. I don't know what to say. Keep doing what you're doing, but that's a spontaneous remission. Um, so what I did to get myself through this challenge of this stage 4 diagnosis was to listen to every single podcast or interview or story of everybody who's had a spontaneous remission. And I was like, okay, I'm going to be one of those people. I'm going to be a spontaneous remission person. And so that's what I feel like we can all do. We can all have the power to connect in with, and especially with the use of the medicines, to a different reality for ourselves, to a different frequency. We are so powerful. We don't even realize our own power with the power of our visualization, the power of our trust, what we put our faith in. We can change things. And so, with all that prayer that happened to me with me in the hospital, they noted that my tumor was way smaller from when they did the colonoscopy from when they took it out. They're like, "Oh my gosh, how did this tumor get smaller?" And they also saw that the cells went from poorly differentiated aggressive cells to moderately differentiated, to when they did another blood test to, oh, well, these are really slow growing, like really, cells that are not so malignant. So the whole prognosis changed. And then it took me 6 weeks to get in for a PET scan. And then they said, oh, those spots on your liver, you don't have stage 4 cancer. So actually you just had this tumor and we cut it out. So I have half a colon. I make a joke that my new name is semicolon. Like Prince has like Prince, like that. So I'm like, I joked them and thought when I woke up in the morning, I was like, oh, and for my colon. I have a colon. But I did water fasting. Water fasting was so powerful. That is a psychedelic experience in and of itself. I worked with the Navajo. I went to the Navajo reservation. I did some ceremonies with them there. And I did Gerson therapy and like lots of mistletoe injections, lots of alternative therapies for the cancer. So now it's still pretty fresh. It's fresh. I'm actually today, I'm going to get a blood test. I'm getting CAT scans and I'm just saying my prayers that all is good. But I feel that all is good. I feel like I needed this experience because what this experience gave me is like, actually, we can bend matter. Why not? Like, we can make miracles happen. We can. We just have to believe in ourselves, and we have to believe in that we are so locked into this mechanistic view of seeing ourselves and seeing the world. And like, wow, there's so many other ways to be in our consciousness. And we can access these different states of being, and we can heal ourselves and help heal each other and help heal the planet. Like, it's time to shift our frequencies into something different. So that's what it gave me.
Wow, what just an incredible, incredible story that touches on so many powerful ideas that honestly I feel like even until this point, in my own healing journey, inklings that I've had. Bruce I don't know if you're familiar with Bruce Lipton's work.
Yeah.
Yeah,
Oh,
he's a
yeah.
PhD from Stanford who wrote The
Yeah.
Biology of Belief. And it's
Yeah.
just like resonates with all of those themes, just the power of belief, the power of prayer, the power of visualization, the power of our mind. I think,
Yeah.
we all acknowledge the psychosomatic connection, and it goes both ways. And so, especially the part where you read every single story of spontaneous remission, and also why aren't we studying this more?
It's ridiculous. So ridiculous. And the doctors always, their response is, well, I don't know. And they never ask. They never ask, like, well, what did you do? Well, just keep doing what you're doing. I don't know. Spontaneous remission.
It doesn't fit within the framework, the paradigm.
No,
And when you're
no.
stuck in a particular paradigm, you have your blinders on and you don't even stop and step back. And a truly good physician is always curious first.
Yes. If somebody told me that, I'd be like, oh my God, tell me what you did.
Yes, that's always
Gosh,
what I'm doing whenever a patient gets better and it's not, the standard textbook answer.
yeah.
Teach me so that I can share it with others who are moving through the same thing. And this is
Absolutely.
what you shared about reading every story about spontaneous remission and calling and claiming that was very similar to what I went through with birthing my daughter, my second child, after I had a traumatic birth with my son. And
Yeah.
I was healing a lot with her birth, healing a lot, that I experienced with my first birth, with my second birth with my daughter. And I was reading every story I could on positive birth experiences. And this was through
Yeah.
Ina May Garten's work. Yes,
Anime.
Ina May.
Yeah.
She published so many wonderful stories. Just I think it was her guide to childbirth that my friend loaned to me, and just half of the book is just birth stories from women,
Yeah.
which I just loved, and all different journeys, right? Like they all look slightly different, but then you start to piece together the common themes, the universal themes, and really, it becomes integrated in your psyche and then in your body to trust the process. And also just the profound surrender that you found yourself in as well, in that process. Like that was just so beautiful to listen to. And the power of faith, and also the meditation that you mentioned too. Can you just mention that practice again? It's called
Tonglen.
Tonglen.
Tong, Len.
Wow.
Tonglen.
Yeah.
It's a Tibetan Buddhist practice.
Yeah, that is so beautiful. Such a beautiful practice. I'm integrating that into my practice today.
Oh, it's so helpful. It's like anytime I get dysregulated or like, I'm like, okay, now I'm going to connect in with all of the working mothers out there who are feeling overwhelmed. I'm just going to breathe in the suffering of us all and breathe out compassion for us all.
Wow.
Helpful with all me and my problems. Me, it's like we're all going through this together.
Mm-hmm. Mm-hmm. Wow, beautiful. So, and yes, like collectively, I remember when you also just the way that you called on your community, which I am a part of just through Inner Trek, was for me also such a beautiful thing to witness because I have a history of isolating myself, and I am going through really hard personal times, and that's the opposite of what we should be doing.
Yeah.
And again, like being in that energy of receiving support when we need it.
Wow, that was a huge lesson for me. So, when I had this whole stage 4 cancer diagnosis, my friends were actually like, "Okay, what can we do? We are going to do like a GoFundMe for Kathryn." And I was kind of out of I got home, like this is right as soon as I got home from having major surgery. I was a little bit altered, it's trauma state. And I was like, sure, yeah, GoFundMe, let's do this. This is going to be really expensive and I'm not going to be able to work. And oh my God, it was so intense to it be like in the same week, you're going to die. The oncologist came in. The oncologist came into my hospital room. I said, what's my prognosis? He wouldn't even look at me. And he said, well, with really intensive chemotherapy, we can extend your life by 1 or 2 years. That was his prognosis. And so to have somebody tell me that, to then, like, literally a week later, to have friends, patients, people have taken classes from me, people I don't know, supporting to my GoFundMe, it was like, receive, you're gonna die. Yeah. I gotta let the love in. Well, it's really hard to let the love in. I can't. It's all coming at once. It was like, I've done so many trades as a practitioner where I haven't actually like got my side of the trade. Like I said, come in and like, you can give me acupuncture another time, but I'm too busy. I never got the acupuncture. It was like the universe was like, here's all of the trades you haven't cashed in on. Just receive it, like all of the karma all at once. But that was a huge medicine for me because I'm a giver. It's really hard for me to receive. Like it's really, really hard. It's so easy to give. And so that was like my part of my big lesson. And I think that's why the cancer caught me off guard, is because it was supposed to be that dramatic. Like I had to be not eating or drinking for 4 days and like have to reach into the quantum to like heal my tumor. And I had to like have everybody like find out all at once and like receive all at once. I guess I'm an intense person. I just needed that like shake up, It might have been different if it was like over a span of time, it trickled in, all this information trickled in, but it was just so,
Yes, I have had similar experiences that were really intense. And I was like, did I have to learn it this way? I think I probably had to.
real, like so intense.
Wow. So how has this, I guess just to close out with one more question that's coming to my heart right
Yeah.
now is how has this possibly, shifted your relationship with death?
Yeah. I am so curious about death. I'm not afraid of death. I really don't. Not ready to go. But I'm kind of actually death is kind of like a person, an entity on my shoulder. Now that I sit with it, like, oh, I'm still not totally sure if I'm clear. Like, you know what I mean? I have this 5 years. So there's always this thought like, oh, could it come back? If it comes back, it's automatically stage 4. So it's something that's with me. But I'm befriending it. I'm befriending it. And like, I'm leaning into it. Not that I want to die. I definitely don't want to die, but just like, what can I let go of? If I'm going to die, how have I lived? Am I really, like, for example, I just taught this class this weekend. I was like stressing out about these details and I was like, just let it go. Like, don't be stressed. Don't be stressed. You don't have to take everything so seriously. Like in the end, is it gonna is it gonna matter if it's like so perfect? No, just let it go. Like the best is to just try not to be stressed. Just live your life, appreciate, love people. Give as much love, receive as much love. Like that's what matters. The details really don't matter. Like if the dust bunny is in the corner, like it actually doesn't matter. What matters is that I'm caring for myself and I'm caring for my community and my children and my husband and my, and I'm receiving. That's what really matters. That's what we need to focus on.
That exact message really came through for me in my most recent
Mhm.
journey with the mushrooms. I hadn't journeyed with the mushrooms for over
Yeah.
2 years since
Yeah.
becoming pregnant and then giving birth to my daughter. And that was the loud and clear insight to that was I was carrying away from that, which is that all we have in this lifetime is the love that we give and the love that we receive.
It's the most important thing. It's and that love is the biggest medicine. Like, that's what I came out of this with. Love is, like, the most important thing that we can do. It's like, that is what's lasting forever. The dust bunnies, or whatever, the conflict, like, if we can approach everything with love, everybody with love, even in their differences, and see where we can connect, like, that's the take-home message for life, I feel like. The more we can step into that, like, the better we do, you know?
Wow, with that, I think we'll close this epic conversation. Such a beautiful message to send the listeners off with. And gosh, Kathryn, thank you so much. Thank you for your wisdom.
Yeah, thank you so much. It was really fun. I really wish you well in your journeys as a mother and a psilocybin practitioner and like all of these people who you're reaching in your podcast. So thank you.
If you enjoyed this episode, we would so appreciate it if you could like and subscribe, share it, or leave a comment. It helps us grow. And if you'd like to learn more about psilocybin therapy facilitation, you can go to our website at www.project-circle.org. That's www.project-circle.org.